Good evening, my people, and good evening, everyone that has been connected online with us. Once again, I bring you this beautiful Friday evening, Dr. Gerald's Healthline. I'm Dr. Gerald Oguzie. I'm here to discuss the topic which was advertised earlier on. And today we're going to be talking about neck pain. There are so many reasons why this topic is being discussed today, and pretty much is because of the common nature of this condition. There are so many names for neck pain. It can be called cervicalgia, and currently there are so many descriptions like text neck, tech neck. All these are because it's a common condition that is now widespread and is usually as a result of the modern society due to the ubiquitous use of mobile phones and devices, poor work ergonomic area where you work, and then I would also add the careless attitude to seeking for treatment is also one of those reasons that has made this condition very common. Going forward, I would like to talk about some very staggering statistics that have been found concerning neck pain, and that's why we're talking about this condition today. It's good to know that 75% of the population will experience neck pain sometime in their lifetime. That's a large number. Again, the second statistics I want to give you is that at any given time, 10 to 20% of the population has got a neck problem. Like this morning in my clinic, I saw quite a number of people. I think if I could remember, close to 9 or 10 people had neck problems sitting in front of me in my clinic this morning. Again, number 3, 5% of neck pain sufferers will become disabled as a result of their neck pain problems. In fact, the American Medical Association has put up the statistics that low back pain and neck pain rank the third in the total health cost in the United States annually, taking as much as a staggering $86 billion is spent on this condition. So we're talking about something that is cheap. Now, another thing that should be noted is that women are 1.38 times likely to suffer from neck pain than men. Again, 30% of patients who have neck pain go ahead to develop chronic symptoms. So they go from the acute phase and the condition persists until it becomes a chronic condition. Also, office workers, manual laborers, and healthcare workers have been shown to be the most at risk of developing neck pain. So this is for the nurses, the doctors, especially the surgeons who can sit in and work doing surgeries for as much as up to 1 hour, 2 hours, 3 hours, 4 hours on a particular case. So you better take note. Now, the amount of pressure on the neck more than doubles for every 15-degree bend. That is, each time you tilt your neck forward or you tilt your neck backward or you put it in another position, apart from being straight and upright in line with your body, the weight doubles. Now, the normal head, the average size of the average weight of the head is about 12 pounds. And when this head is tilted forward about 15 degrees, it becomes about 60 pounds in weight. So it is very important that you adjust to make sure that you take proper care of your neck. And that's what we're talking about this particular evening. It is very important for you to know that it is usually as a result, this neck pain we're talking about is as a result of leaning over on your computer, leaning or hunching as you operate your smartphones, bad sleeping posture, and then not leaving out osteoarthritis, which is a common condition as one ages. And so these are some of the common things that will cause neck pain. Now, what's the anatomy of the neck? Now, the neck region is that part of the body that is carrying the head. Okay, so as you can see, my own body, this region is my neck. And in that neck, there is the bones that are aligned in the middle of the neck. They are called the vertebrae. And in the neck region, they are called cervical vertebrae. There are 7 of them, and they are lined up one on top of the other. Now, this pain, this neck, once you have pain in any part of this region, that is described as neck pain. It can be an acute pain or it can be a chronic pain. Now, what are the common causes of pain in the neck? Remember, in between every bone, there is a disc, and that disc is what helps to absorb the shock in the neck and also allows a pliable motion that takes place in the rotation and movement around the neck. What are those things that cause this neck pain? Number 1, I want to talk about muscle strain. When there is overuse of the neck, this overuse can result due to the nature of the occupation of the individual, can have poor posturing from the way you sit in the office, the kind of seat you use, the position of your computer, and also the position that one sleeps in, especially how you use the pillow and the type and the size of the pillow that you use. These can be predisposing factors to developing a neck pain. Now, talking about the computer, when you stay in an awkward position, like those who place their phones in between their neck and holding it between their jaw and their shoulder in that position, that can be a cause for neck pain if done consistently. Again, if you are the bed reader, you're someone that likes reading on the bed, that can predispose you because you're going to put your neck in an abdominal position to be able to see what you're reading, and that can increase your risk of developing neck pain. Another very important cause of neck pain is osteoarthritis. Osteoarthritis that occurs in the joints that are around the neck. These is one of those things, as we described earlier on when we talked about low back pain and when we talked about the knee joint. It causes wear and tear of the joints around the neck, and so this can also predispose the individual to developing pain in the neck. But this is more common in the aged, those who are in their elderly state. Again, nerve compression. Anything that can compress the neck around, the nerves around the neck, can be a reason for developing neck pain. Now, what are those things that can put pressure on your nerve in the neck? These are like the herniation of the disc, a disc prolapse. These can go ahead and put pressure on the nerve roots that are coming out from the neck and cause pain in that individual. You can also have osteophytes that arise from osteoarthritis, the wear and tear, new bone formation. They can put pressure on those nerves that are coming out from the canal into the upper limb and result in pain for that individual. Other things like injuries are also very common. Injuries are result from road traffic accident. Very important description. I would like to talk about the rear end collision. Now, where an individual is driving forward and then or is static, and then another vehicle bumps into the back of the vehicle. That results in a quick, motion, a jerk of the head backward, and that can cause an injury to the neck, commonly described as a whiplash injury. Other things that can cause injury, like sports, very important, and also fall from height. Those that climb up trees, the palm wine tappers, and people that like to climb trees to pluck things and they fall and sometimes land with the neck. Not leaving out, very important cause of injury to the neck is the diver's injury, where one takes a deep dive into a shallow stream and hits the head on the neck or the head on the floor or the depth of the sea or the pool, as it were, and that results in a major force being transmitted to the cervical spine, resulting in injury. And many have gone ahead to become paralyzed following this. That's one of those severe things that can happen. There are other diseases like rheumatoid arthritis, inflammatory conditions that can result also in neck pain. Then we also have other conditions that may not necessarily be related to the neck, but also span through the neck, causing neck pain, like meningitis. Now, meningitis is infection or inflammation of the meninges. And when they occur, individuals would have neck pain and also neck stiffness. There are some cancers that can send metastasis to the bones of the neck. And not leaving out, also very importantly, heart attacks that can result from heart problems that send radiation or pain towards the neck region. So there are several other things that can cause, but I just want to discuss these common and highlighted ones. Now, what is the clinical feature? How does people with neck pain present to the clinic? One of them is pain. And sometimes this pain can be an acute pain, that is to say, it started suddenly and recently, or a pain that has been slow, insidious, gradual in onset. And sometimes the pain can be dull or the pain can be sharp, located right around the neck region. Now, this pain may be a radiating pain, that is to say, the pain moves from the neck into the shoulder region and also goes into the limbs. The pain can also radiate down to the anterior part of the chest, or the pain can go backward towards the upper part of the back. The pain can also radiate sometimes towards the head and even result in headaches. So these are some of the ways that individuals can present. Following this, there may be an observation of a tightness around the neck, that is spasms around the neck. The individual has difficulty moving the neck around freely. And then there is headaches, as I've talked about. And if the symptoms is as a result of nerve compression, you may have symptoms like tingling sensation in the upper limb that spans all the way from the shoulder to the arm to the forearm and sometimes gets into the hand. Now, you have some situations where there is weakness. The individual experiences weakness in holding objects. Sometimes it worsens to the point that objects like cups can drop out of the hand of the individual. And if this gets to the extreme, you can have even paralysis. So this is why we are looking at this condition this evening, because it has very reasonable things that you can see. And once you see them and you present to your doctor, you may have a resolve or resolution to solve this problem. When do you see your doctor? Now, because of the common nature of this condition, many do not present to the hospital immediately. But I must tell you that if you have a neck pain that it has lasted for more than 1 to 2 weeks, please go and see a doctor. Another thing is, if the pain is such that it is following road traffic accident or an incident of fall, then it is also good for you to see your doctor, because there could be a fracture of one of those bones in the neck, and that can result in it becoming displaced and causing symptoms subsequently. Now, if the pain is becoming worse, that is to say, is progressive, the pain is worsening over time, you now have the pain becoming a shooting kind of pain, okay, quite severe, then that's also another reason why you should run to your doctor. Again, if you have the pain radiating down the arm, down the forearm into the fingers, sometimes the pain can even go down the body. That's also another reason why you should see your doctor. If you're experiencing the pain and the pain is causing weakness of the upper limbs, then please run to see your doctor. Now, the doctors are there for you. And once you get to the doctor, remember to take note of your symptoms. What are those things that you feel most of the time? Make sure you put them down and you express them to your doctor. Now, the doctor, once he sees you, the first thing he's going to do is to take a history, asking you the questions of how the symptoms have been and all the things that you have experienced. And then he's going to go ahead and do a detailed clinical examination. Put a few pressure points, locating where the pain is worse. Try to put your neck in a few positions just to see exactly where the pain is. And all these will help him make a diagnosis of the particular reason why your pain has arisen in your neck. There will be some investigations that will be done. Now, very importantly for us in the investigation part is the x-ray. The x-ray will describe and show us the bone. When you look at the x-ray, you're going to see the bones are lined in the order of straight, they just straight out. And if you look at it from the lateral side, you're going to see there is a curvature on the neck. Now, that curvature is normal, and the doctor is going to look at all those and be able to assess the current situation of your neck. There may be need to do other investigations like the MRI, CT scan, electromyography. The MRI is one that is very helpful to identify those that have got pressure on their spinal cord, on the nerve roots in the neck. Now, once the MRI is done, the doctor, the surgeon, pretty much the orthopedic surgeon or the neurosurgeon will be able to tell you whether you have a spinal canal stenosis or whether the nerves are free. Probably it's a muscle spasm and all that. Based on the examination and the investigations that have been done, put together, we'll be able to say exactly what is wrong with you. And then treatment will ensue. And in doing the treatment, there are several things that have been tried. So many people have done so many things to be able to help them. Now, I just want to say yes. At home, some have tried. You can use ice and heat therapy. That is applying a cold compress around your neck, alternating with a heat compress around the neck. Yes, I remember sometime when I traveled to the United States and I was involved in a bumper accident where someone hit us from the back. I was sent straight to physical therapy, and it was very helpful in relieving the neck pain. So yes, I've also had that experience. So it's very helpful if you can imbibe some of the things we're going to talk about. Again, exercise and stretching can be very helpful. Okay, but you must do this guided by your physiotherapist so that you don't overdo it and cause pain. Sometimes the doctors will give you some painkillers and analgesics just to help relieve your pain. As I always warn on every segment, whenever I come on here, I try to tell everyone to make sure you're careful with what you buy over the counter. Many people have resorted to helping themselves by going over the counter to buy medications, and this has resulted in buying drugs that has caused them severe damage. Such drugs like the use of steroids. I always try to emphasize this because many people in the course of their pain are desperate and they go in this direction, but the results are usually very, very damaging. So avoid those conditions. Now, there are other drugs that you can be given on medications such as muscle relaxants. There may be need for you to wear a neck collar. Yes, I know most of my patients usually have a little reserve with wearing a neck collar because it brings a lot of attention to you when you're putting on that collar around your neck. But if it's necessary that you do it, then I must tell you, you have to do it. Now, I want to emphasize that in using the collar, make sure that you're using the collar as prescribed by the doctor. If you use a collar that is not prescribed by a doctor, you may run into trouble. What does that do? It may worsen the symptoms. Yes. How does it do that? Because the muscles around the neck, the paravertebral muscles, and the other muscles that support the neck perform their duties of carrying the head. And when you wear a collar for a long time, unprescribed or unguided by a doctor, those muscles will relax. And whenever you take off the collar, what happens? The head becomes too heavy for the muscles to carry because they've had the collar around the neck for a long time that they're not used to carrying. So it worsens the individual's pain. I've had this kind of complaints come up severally for people who went and just bought a collar and started wearing it, and it worsened their outcome. So be very careful. Other treatments that can be done, traction. Sometimes you can do a cervical spine traction. They just put something on your neck, you're lying down, and then they put a weight to pull and cause some distraction. That has helped a few people who have got some compressive symptoms. And then lastly, where indicated, surgery is one of those options. Yes, I said surgery. is one of those options. Not very common, but yes, it's done for those that are appropriately indicated. When the pain has lasted a long time, for those who have got some chronic pain or some severe form of acute pain, and you do the necessary investigations like the MRI, which is called magnetic resonance imaging. Once these investigations are done and we see that there is a spinal canal stenosis, that is something putting pressure on the spinal cord, on the nerve roots as appropriate, yes, this will result in the surgeon suggesting you having surgery. Those that have got discs putting pressure on their nerve roots, this will result in surgery. Like about 2-3 weeks ago, there was an elderly woman. She was about 76 years old, and we did her surgery. We did a spinal decompression surgery for her. Okay, they can go in from the front or can go in from the back. So the surgery is done and it's safe, and it got good results, especially when it's done early, so that you can recover the functions of the limbs, especially the upper limbs, so that you can use your hands again, especially when they're weak because of the pressure symptoms that they're having. Now, in doing the decompression surgery, sometimes there might be need to use an instrumentation. That is to say, putting an iron into the body to support the neck where we feel that that's necessary. So your doctor is going to discuss this with you. Like I always say, make sure you go online, study about it, ask all the questions, find out the complications, and go ahead and do the surgery if that is what is indicated. We can always guide you as you send in your questions and your comments to make sure you make the appropriate choice for the neck care. Now, I will not always end my conversation without telling you how to prevent this condition. How do we prevent neck pain? Very, very important. And I must tell you, if you must pay very close attention to this segment of the discussion. This talk is so contemporary because we are in the modern days, and you must use your laptops, you must use your phones, you must use your tablets, and you must go to work. And some of these are the risk factors for developing neck pain. So let me take it one after the other. I'm going to try and run slowly so that we can understand ourselves. But don't forget, you can always write in and ask questions if there are areas you want us to clarify further for you. Now, number one thing for preventing this condition is to keep your head centered over your spine. Now, you see the way I'm sitting down, straight up. My head is right there, centered over my spine. Now, that's exactly how you're supposed to sit all the time, in your office place, at home, and wherever you go. Now, this is the appropriate position so that the head is carried by the neck in the center, and the weight is transmitted through the spine, down through to the lumbar and down to the feet where you are standing on. Now, I must tell you that there are simple changes that you can make in your daily routines that can bring about remarkable results in the neck pain if you have one. So I'll start by talking about good posture. In the sitting position, in the office, especially when you're reading, make sure you sit with your back resting on the back of the seat. So you align your head, your neck, and your chest. They are aligned. That's very important. Again, it'll be good to use seats that have got handles. That is to say, the seat has got a handle so that you can support your arm, okay, and get your shoulder to be up and also relaxed. That's very important. Now, if you are the type that flies frequently or travels frequently, it may be good for you to use some neck pillows to support your neck during such long flights, so that when you place it in a position of rest, you are not in any way putting it in a position of strain. When driving, very importantly, I'll advise that the headrest at the back of the head should be up and not low, because when it's low, it gives the chance for the head to bump and go backward, and that can cause a whiplash injury. But if you have the headrest raised and supporting the occipital part of the head, that reduces the risk, because all you do is once you jerk forward, the head hits the back, okay, and is supported. Now that's a very good way to prevent your neck from having pains. Again, sleeping posture. If you are a tummy sleeper or a stomach sleeper, those who sleep with their tummy face down, then you have to turn your neck left or right. You put a lot of strain on your neck. So that's not a good posture. The best postures are for you to be lying supine with your back or with your side, using appropriate sized pillows, soft, that will not put your neck. It's not good for you to be lying down and sleeping and your neck is tilted. So you must avoid those kind of pillows. Again, number two, I would like to talk about if you are the type that walks, in a position that keeps you sitting or standing or in a particular position for a very long time, you have to take frequent breaks. I prefer, every 30 minutes you kind of stand up and you take a walk and stretch. Like in my clinic this today with the, several patients sitting out there and waiting. By the time I'm sitting down for about 30, 40 minutes, I get up, I take a little walk. Well, most of the time we stand up in between to examine patients, come back to the seat. So that gives us a little position change. It helps you to change the position of your neck and relax yourself, relax your muscles. Okay, so that's very important. Now, I also talked about adjusting your desk. Adjust your desk. That is to say, in your office, if you have a seat that is too low, okay, make sure it's appropriate with the level of your table. You have to sit in a position that your knee is either below or at the level of your hip. And then your trunk is positioned straight. Your neck is centered over your body. That way you're sitting upright. But if it allows you to bend in any way, bending forward, backward, or any other posture, you're increasing the risk of developing neck pain. So your monitor for your computer should be made in a way that it is high enough that you are looking at it at the eye level. So we're talking about watching your screen at eye level. Very important. Okay. Now, if you are using your phone, okay, I'm going to try and get this to demonstrate. Now, many people, when they're using a phone, they keep the phone down and they look at the phone down. Now, that's one of the reasons you have neck pain, because it increases the weight of your neck. The moment you bend your neck forward, as I'm doing right now, you have a head that is weighing 12 pounds becomes a 60-pound weight transmitted through your cervical spine. But if you can only but hold up your phone to the eye level, that is to say, if you are operating your phone, so if I'm looking at it from this angle, if I'm going that way, I want you to see the phone is in this position and I'm operating the phone. Now that's a better position for you to use when applying your gadget. So don't look down. That's very important. Okay? Now, avoid tucking your phone in between your ear and your shoulder. I said that earlier on. Okay, so avoid this situation where you place your phone in between and you're trying to make a call and you got it stuck in between like that. That will also increase your risk of developing back pain. Now, if you have to make calls in a position where you cannot hold your phone, better still use a headset or get a speakerphone or use the speakerphone. So what else do you do? If you're a smoker, I'll always tell you to quit smoking, because smoking also increases your risk of developing neck pain. Avoid carrying heavy bags with their straps around your neck. Let's say you're traveling and then you put on that bag and the strap is all over the neck that way, and then you are moving. That puts a lot of pressure on your neck. So please avoid carrying a bag with your strap around your neck. Now, I said earlier on, don't use a neck brace or a neck collar without your doctor's prescription. It will worsen your neck pain. And then avoid certain practices. There are several funny practices. I have come in contact, people telling me, even in my clinics, okay, some people try to move their necks with a jerk force, like move it fast that way. Some do that, pushing and hearing those clicking sounds. And they feel that when they do that, it relieves them of the pressure. Okay, some people have asked people to carry them up with their neck in a bid to stretch the muscles. No, that is not the way. That can cause severe damage and injury to your neck. So you must avoid those kind of practices. And if you want, you will be advised by your doctor on the particular exercises that you can do. We recommend you see a physiotherapist or a physical therapist who will be able to guide you on the right exercises that would help your neck. There are different exercises that you can do that are safe. You can move your head, from touching the jaw on top of your chest. You can stretch them gently, and you're told how to rotate, how many times you do it to be able to get your neck muscles steady, strong, and able to carry your neck. So I want to say today, I hope that with these few moments that we've spent, you've been able to get this message concerning your neck pain. It is a very common condition, and you need this advice, but not just merely hearing them, but also doing these things that we've said. Just make these adjustments. You don't need to wait to develop neck pain before you actually adjust them. As you do these things, you begin to observe. Now remember, the bed you sleep on is very important. If it's not a soft foam, if it's a soft foam, you may need to get a firm one. Okay, remember, preferably sleep on the back, on the side, use soft pillows, and make sure you imbibe the other things that we've talked about. I just want to thank you this evening for joining in. And don't forget, you can send in your questions, your comments through the inbox, and I'll respond to you as appropriate. I really want to thank you for tuning in. Watch out for the next edition. We're coming on live to give you another topic that is going to bring you information concerning your health, because you are only as wealthy as you are healthy. Thank you very much for listening, and see you again during our next discussion. God bless you.